All right. Greetings, everybody. Good afternoon, and welcome to the Live Healthy Miami Gardens weekly Facebook Live series. We are grateful for you joining in with us on today. We know that this Live Healthy Facebook Live that comes to us each week centers around our health and wellness, and we're so grateful for the efforts at the City of Miami Gardens that really works hard with various initiatives to make our community healthy and whole, mind, body, spirit, and soul. And so each and every week. Today, I am Dr. Cheryl Coleman, the CEO of Abundant Living Health and Wellness Resulting Services, a part of the Live Healthy Miami Gardens family, and I will be your host today. Our topic today is an amazing topic. As we look at being healthy and whole, mind, body, spirit, and soul, we need to be empowered as patients. Patients are those who are seeking the resources, whether it's from our primary care facilities, the hospitals, or connecting in the communities. We want to make sure that our patients, those who are seeking out services, are empowered. And so that's what our topic is on today. We're going to be talking about patient empowerment. We have some amazing panelists that will be joining me on today as we share in this Facebook Live. As we're getting ready to dive into our topic on today, I want to share with you those panelists who will be with us on today from the UHI clinic. And so with that shared today, we will have the following individuals, healthcare providers, joining in with us and leading us in this conversation around patient empowerment. First, we'll have Dr. Suzanne Minor, who is a board certified family physician who attended the University of Miami School of Medicine, and she trained at Jackson Memorial Hospital. That's where her residency took place. She is passionate about the underserved care. And so therefore she completed her National Health Science Corps commitment working with the North Dade community in 2010. And she joined FIU, my alma mater, yay, International University. And now she serves as the assistant dean for the faculty development teaching program there as she's working with medical students. Her mission is to empower others through knowledge, listening, and connecting. Guess what? She's so passionate. She's going to be joining us in just a few, as again, she's working with patients, but she's not alone. We have Brooke Swartz, who's with us, a third year medical student that went to Herbert Whitehead College of Medicine, aspiring to enter the field of pediatrics. Yay, pediatrics. She is from Parkland, Florida, and she went to the University of Florida for her undergraduate degree in biology. She chose medicine to make a positive impact on the health of others. They can best achieve their goals. We have some awesome, passionate healthcare providers that's going to help us with this topic on the day. Guess what? Brooke is not alone. Dr. Minor is not alone. We have Seema Al Shakili with us, another third year medical student, again at the Herbert Whitehead College of Medicine, who plans to enter the field of diagnostic radiology. We need it all in our healthcare field. She is originally from Orlando, Florida, and she went to the University of Central Florida. Yay, UCF. My daughter went there. We've got so much in common as healthcare providers for her degree. And she's got some specialties that she's going to be focusing on, and that's women's and gender studies in medical psychology and anthropology of global health. She entered medicine because she's passionate about empowering women through their health. And so our Live Healthy Miami Gardens family, we want to welcome our panelists on today. And as we have welcomed and introduced them and shared our topic, we're going to dive right in because patient empowerment is truly at the heart of making sure that lives are different. And so with that shared, I'm just going to dive right in, and either one of you can jump in and answer this first question as we think about patient empowerment. And the question simply is, as healthcare practitioners, how important do you think it is for patients to become engaged in their health outcomes?
Well, thank you so much for having us. We're excited to be here today. We really care about about empowering others in the community. And I think this is the question. I think it's very important. That's the short answer. And the longer version of that answer is it's not the doctor's body, it's not the doctor's life, it's the patient's life, it's the patient's body. And I'm a consultant to hopefully help the patient to make decisions. But the patient is the person that lives with their body, that lives with their decisions, that lives with whatever it might be going on. So I'm like the garage you take your car to, but it's so important for the patient to be actively involved and engaged in what's going on with their body. And then as I was thinking about this question, I thought of a couple of things to possibly bring up a little more. Sometimes when patients come in to the doctor, they might be relying on their spouse or their parent or their children to answer questions about what's going on with their body and their health. And that is something where I know, okay, I need to have a quick conversation because I I know that the patient is not going to be able to get the best care for themselves and take care of themselves as best as possible if they don't feel responsible for their health care, if they're not the ones answering questions about their body and about their health. So I really encourage the patient to feel that you have responsibility and are fully empowered to answer those questions and to make decisions about your health care. And then something else that I think is important to mention is that often healthcare is in that important but not urgent category of things that we need to get done. It's not something that's urgent. It's not something like a flat tire that we have to fix right away often. Usually we can kind of get by a little more because our bodies are incredibly resilient. But the challenge is we need to figure out how to prioritize ourselves sometimes. Yes, we need to put food on the table. We need to do certain things that are like really vital and foundational for us. But then it's really important for us to feel entitled to prioritize our health and our well-being. And that might mean something different for each of us. It might be exercise that day. It might be getting enough sleep that night if you can. It might be just calling to schedule a doctor's appointment or getting that flu shot or that COVID booster shot or having a conversation with somebody about your deep fears related to medical care. But I wanted to make sure I brought those things up.
Totally awesome. And we're grateful that you brought those things up because I'm sure all of us agree that it is really important for our patients to be a part of the process. Again, as you highlighted so beautifully, because it's their bodies. And so we're grateful. And I don't know if Seema might want to add some steps as a healthcare provider that you take to empower your patients to be active in achieving healthy outcomes.
Some steps that we take as providers to help our patients take, those steps to healthy outcomes is, during our appointments, we try to make it really clear, what the next steps are for the patient. We really, try to summarize throughout our visits what we're doing, why we're doing it. And if a patient, maybe doesn't agree with our plan or doesn't think it's what's best for them, we kind of alter our plan based on that because obviously the patient's input is, extremely important to our treatment plan. So I think that's a really big way that we, like a practice that we use with all of our patients is just continually like engaging them in the process, summarizing it in a way that they'll understand, and just like condensing it in a way that when they go home they'll remember like what they have to do and what the next steps are and kind of what's expected of them and expected of us.
That's awesome. Basically, making sure that we're engaging them and making them feel empowered is really, really awesome. We do know, and I see that you all are serving, and yes, we still are not totally out of this pandemic. And the pandemic has changed. Yes, we see those masks. We're putting those plugs in for those masks, right? We know there's a lot of COVID fatigue, but again, we still have to do the things that keep us healthy and whole, and that's also protecting you and the patient. So we're grateful for that. And as you guys have given really good information, we still recognize that there's a lot of people who feel overwhelmed navigating our health system, right? And so we might talk to them about, asking the questions and knowing that it's their body. But even when they try to stand up and they try to do that, we've experienced a lot of challenges in navigating. So what advice would you give to patients or your clients that are coming in that just feel overwhelmed with navigating the health system?
So I would say that the first thing I would say is that you're not alone. I'm a physician, and oh my gosh, the years of training that I've had as a physician, many years, and I feel overwhelmed navigating the system of healthcare in the United States. It's really difficult to navigate our healthcare system, and I have a medical degree, and I still have a hard time doing it. So I think first, know that you're not alone. There's nothing to be ashamed of. If you're having difficulty navigating it, it's not that there's something wrong with you. If you're having difficulty navigating it, it is a really difficult system to navigate. There's nothing user friendly about it. It's a challenging system. So first, know that you're not alone, and then I think of the Serenity Prayer. What can we control and what can we not control? So I think it's important to first think about, like, what are the tasks that we need to do and break it down. So an example that I think of with breaking it down is like, there's a saying that I know of is, how do we eat the elephant? One spoonful at a time, or one bite at a time. So that's a one way we can think of breaking it down. So if I need to schedule a mammogram, well, what's the first thing I need to do to get my mammogram done? Well, I need to get the phone number out and then plan to call. So I can break it down into step by step by step. So call the doctor's office to get maybe the first step I need to do actually is get the phone number to call the doctor's office. So then I can get that referral from the doctor's office for the mammogram. So break it down. What's the step that I need to do immediately? And then I think something else that you can do, which I do when I go to the doctor as a patient, because I don't enjoy being a patient either. I'd much rather be the doctor, is to make a list. So when I go to the doctor's office, like, what do I want to make sure that I go away from that doctor's appointment with? So I have my list that I go to the doctor's appointment with to make sure I am covering the things that I want to cover, and I don't get out of the room and go, oh, I forgot to ask about this. So I have my checklist that I bring with me as I'm going to the doctor's office. And that way you can make sure that you cover any issues that you want to make sure that you cover. And then the doctor might say, well, I think that these are the 3 most important things today, because those are the things that are the most dangerous. And that's legitimate and appropriate. But then that way you can say, okay, so like, when can we talk about these other things? Because they're also still really important to me. And what we would do is have you come back very soon. But I don't want to overwhelm a patient with too much information. I know as a doctor, if I'm starting to feel overwhelmed that I'm giving the patient too much like homework, I probably need to back off a little bit.
That's amazing. And that's a very, very good advice, step by step, definitely when you're feeling overwhelmed. And you have others that are with you that if they have other tips, we want to hear all of those tips. So if any of you others want to chime in and add on to that, of course, that step-by-step process. And what is really powerful that she shared is you're not alone. Oftentimes we do feel alone in this journey. And so we thank you for being so transparent and even sharing, you with the medical degree, having the challenges. And so we're not alone in step-by-step process. Anybody else want to just chime in and just share any other tips that would help?
Yeah, I think it's important to find a physician that you feel comfortable with and that you trust, because going to the doctor can be super scary. And if you're already feeling overwhelmed, you don't want to be faced with a physician who makes you feel uncomfortable. So something that comes to mind is like culturally sensitive care. We try our best to make sure that we're providing that, but we aren't always aware of when we're lacking or when we're not providing that. So patients should speak up when or should feel comfortable speaking up when we are providing care that doesn't align with their values. And I think that when providers do, when we are able to provide care that aligns with their values, then there's less of that feeling of overwhelm, like feeling overwhelmed on the patient side.
That's even more powerful. Trust in these times and having that provider that you feel open that you can talk to and that they would listen to you. That's powerful as well. And so we hear the step-by-step process, knowing that you're not alone, developing that trust with your healthcare providers. Any other tips that we have?
You might also bring somebody with you to the doctor's appointment. There are studies that show that what the patient hears that the doctor says might be 20 to 50% of what we say. And yes, there's certain words, like if I say cancer, often that number goes even further down. So it really is helpful to bring somebody with you that you trust, who might take notes for you, or also might help you later on after the visit. If you were like, oh, I don't remember what they said about this, that can also be really helpful.
That's amazing, because that actually highlights what you started out when you said you're not alone, right? And so a support system in the midst of us going through our health journey is always something that's great to have as we're maneuvering through. As you share, bringing in family members or whoever that support system person is for you. What role do you think as healthcare providers, or what types of trainings that do you all go through to be sensitive to those needs of the patients as we think about empowering them?
That's a perfect question for you too.
Yes. We learn a lot about patient empowerment in our clinical skills courses, as well as like something we call OSCEs, which is like a fake patient interaction. And we're often guided more heavily on our interaction with the patient, as opposed to, oh, did you get the correct answer? They really want us to be like not only competent, but also sensitive and aware of how we're coming off in smaller ways, like body language, eye contact, how we make the other person feel, how fast are we speaking, and things like that.
And you're bringing me back to nursing school and our patient satisfaction. And then when we're when we're in our roles in our various institutions, making sure that we're staying sensitive to those things, because sometimes in the hustle and the bustle of seeing many patients, it can get a little tough sometimes. But we are grateful that, again, those ongoing trainings to help us to provide that culture where we are empowering our patients to be a part of the process is so very important. And so we do applaud you all for, taking time out of your busy day and taking time to address this important issue as we think about empowering our patients. And in the midst of that, the word advocacy comes up, because even though we can provide that atmosphere, sometimes people, we're living in a time where people feel, to be honest with you, helpless and hopeless, not just about their physical health, but their emotional health, their mental health, financial, occupational. We've had so many challenges in the midst of this time that we're serving in. So advocating, I don't know if any of you, if anything jumps out at any of you as it relates to advocacy, as it relates to empowering our patients. If there's services, if people don't have a support system, or are we encouraging our patients to advocate for themselves in the midst of it?
I mean, what I'm thinking of is, kind of going off of what Brooke and Dr. Minor said, like, obviously one way is to like advocate for yourself, within each doctor's visit. You can act as your own advocate. And I think that they gave some great tips, like Dr. Minor said, like kind of going into your appointment, like knowing what you're going to say, what you want to convey to your physician or your provider, maybe even like writing down a list, because in that moment it's easy to kind of feel overwhelmed or forget things, or kind of forget all the things you want to address. So I think really like prior to your visit, maybe like sitting down and like making a list of all the things you want to talk to your doctor about. I think that can be like one little tip to like help patients advocate for their needs with their provider. I think another way, and just kind of like advocating for yourself like within the system, is like kind of, I mean, I'm speaking as not only like a medical student, but also like a patient myself, is, like keeping track of your health records. Like, I think, when you get a lab test done, kind of ask for a copy of it, keep like a little health portfolio, because we all know that, we switch providers, we switch insurance, which ends up, we have to go to a new clinic, we move states, we see different specialists. So kind of like building your, you can even put it in like a binder or something. I've seen patients do, and just keeping track of your, like, whatever images you had, whatever lab records you had. Another tip is like, if you do get like a lot of lab results, maybe try to go to like the same, like lab provider, like Quest or something. Like maybe every time go to Quest, and like, you can just scroll through all your results for however long you've been having them, and just you have easy access. So whenever you see a doctor, you can just easily show them like, hey, like I've had that test and it showed this, or like, yeah, this time this, result was elevated. So, it really can allow you to have like an efficient healthcare visit. And it really shows your provider like, hey, like I am taking my health seriously. And like, in that moment you can advocate yourself with, some evidence. So those are just some tips that I would give for like advocating for yourself within like a visit.
And that's awesome. And thank you so much for those tips around advocacy. Again, keeping your own medical records and keeping up with where you are in your journey, and just speaking up for yourself. And I think it was Brooke who also shared. Your questions that you would write down before those visits, and those journaling through the process is definitely very, very helpful. And I'm quite sure, even though you're in your setting there, but there are people in your communities who know that you have a medical background. I don't know about you, but I get a lot of calls. Just yesterday, I got a call from a family, and they were sharing that the primary caregiver, because we got a lot of caregiving going on since the pandemic now, and so the primary caregiver of the individual who contacted me suffered a stroke. And so very, a lot of deficits now. That person is needing to be discharged. And so the safe discharge from the hospital is in question because the person cannot take care of them. And so I'm grateful that I see advocacy. And so I'm sharing this experience that I just had on yesterday. And that person did everything they could to navigate within the system, but then reached out to healthcare providers such as myself to help them. And what I want to share in this experience that I'm feeling very proud about, because sometimes when we're stressed in our health community, when we contact each other, sometimes it can be like, whoa, but this experience was very positive. I was able to work with the social worker in that hospital, share that this person was advocating, and to start to work through a solution. We're not done yet, but these are examples of things where individuals can, when they feel like they've gone the last mile of the way, as Brooke shared, you're not alone. Individuals will reach out. And I'm not sure if any of you have had any of those experiences outside of work, just based on people in your communities or in your families that need that help.
Yeah, thank you for bringing that up. Certainly, all of us, I think, get those questions as a physician. I get a lot of those questions, and those questions started in medical school. And there's a tone of voice that the medical question is coming. So yes, I think that we all get those phone calls. I also wanted to bring up with advocacy. I think of advocacy for ourselves individually, but then I advocate for patients by voting. I think that's a really important way to advocate for patient care. I also advocate for patients by emailing and calling my state representatives, my state senators, my House of Representatives, my representative in Congress, and my senator in Congress, and the president. Like, we actually have access to all those people. I have in my cell phone programmed White House call center. And that's something that you can do on the bus or on my drive that I can do. And I, of course, I'm not going to share patient information that's personal, but I can call and say, this patient that I saw today didn't have insurance, and that really affected their health care. And we as a nation really need to work on health care for our patients without insurance. because we're paying for healthcare in the most expensive way possible. So we can advocate for ourselves individually, but then also as people who are working in healthcare, I think we can advocate for patients through the legislature. And then I think patients, it's really important to also advocate by voting and reaching out to our representatives as well.
And that is awesome, because oftentimes I get the question when I show up with my social justice hat on, as it relates to healthcare and getting the vote out just recently, souls to the polls, whatever way we could. It's a bigger picture, because when we think about health, it's not just our physical body. There's 10 dimensions of health, and so we need the environment, access, like you said, to healthcare. And again, knowing what's happening in the legislature as it relates to all of our well-being and navigating through the system, that's powerful. And so knowledge is power. And so we're absolutely really, really grateful for you all taking time out of your busy schedule. I know that you all have patients that are waiting for your attention, but this is such a blessing for the community to have you all to come and to share your expertise, and to just, put a highlight on the empowerment that patients have, and the active role that they need to take ownership of their own body, because it is their body. And then we're just the partners to help to facilitate their wellness journey. And so we're absolutely grateful. Lastly, before we go off, UHI Clinic, do you want to share anything about the services that you all have, and let them know? We see your website is coming across the screen. And so we'll give you a moment to do that before we allow you to get back to your patients.
UHI Clinic is in the North Dade area. We see patients who don't have insurance. So we actually don't see anyone here who has insurance. In order to come here, patients need to fill out paperwork and can't have any insurance. So we are able to do blood tests here for cash services. And of course, actually patients who come here get to work with medical students and nurse practitioners. And we know that when patients are working with medical students, they actually get more time and they get more patient education. So I'm very proud of the healthcare that we are able to provide here for patients.
Thank you so much. And that is powerful. In my 30 years of practice as a nurse practitioner, served as director of critical care, emergency services, in teaching facilities. And I do know how important patient education is. And so we're grateful for our medical students who do take, now doctors, we're not saying that once we're out of med school, we're not taking the time, but because of where you are in your service and going through the journey, it makes the difference in so many people's lives, just to take those few extra moments to make sure they're educated. And as you were talking, Brooke, you shared the services that you have. That's a way of empowering people, because the scenario I was telling you, the individual didn't have insurance. And so therefore probably did not access services early enough to make a difference preventatively in that situation. And so we're grateful for the services that you all are providing, grateful for each one of you. And we just pray that you're blessed in the rest of your journey. We thank God for Dr. Minor, which we know is with patients. And we thank you for being with us and Live Healthy Miami Gardens Facebook Live, as we educate our community for those people who live, work, and play in Miami Gardens. Thank you all so much.
Thank you.
Thank you.